Room check. If I move it any further, my lap is just, and we're on a little board. We're professional. Okay, so just starting the timer now. Okay. Hello, my name is Michelle. Can I ask what your preferred name would be?
You can call me Nicole.
Awesome. Hello, Nicole. It's very nice to meet you. And this is our second session together, correct?
Yes, it is. I'm back.
Awesome. Well, thank you for coming back and, talking with me today. Just before we begin, I do want to go over a few things, regarding confidentiality, what you can expect during the session and my role in the session as your counselor today. I know we went over it a little bit in our previous session, but just to go over everything, is that okay with you?
Yeah, for sure.
Awesome. So once again, my name is Michelle. I'm currently a student at Fanshawe College working in the mental health and addictions program, and I will be your counselor for today. As far as what you can expect during the session, I just want to let you know that this is a safe space for you to share whatever you feel, and whatever you would like to share. Um, and my real goal in this session is just to listen, understand, and everything that you're saying, um, and see how we can work together moving forward. When discussing confidentiality, that just basically means that what you share here with me today stays private and between us, unless there are, a few concerns that may pop up. The first one is if you're a risk to yourself or, there's danger or risk to others. And you mentioned that you disclose any form of child neglect or abuse towards me, or if I'm subpoenaed by a court of law, then I would have to share some of the information that you provided with me in these sessions. With all that being said, do you have any questions for me at all?
No, I think that all makes sense.
Awesome. So Nicole, just going forward, can I ask what brought you in here or on this meeting here today?
Yeah, so when we talked last time, I really wasn't open to the idea of cutting back on my cigarette intake, but I went back to the doctor again about 3 weeks ago, and my blood pressure is still not very good.
Yeah.
So that kind of scared me a little. Made me start thinking about things. And, my doctor gave me another encouraging suggestion to book another session with you. And um, so I did. I took her advice, and, here we are again meeting.
Awesome. So do correct me if I'm wrong.
Mhm.
But I just remember from our last session, you did talk about how you smoke 5 to 6 cigarettes a day, and how your doctor has recommended that you come to counseling for concerns with your blood pressure. Is that correct?
Yeah, exactly. She just wanted me to be open to talking to somebody about the thought of quitting or cutting back and, the implications that it's having on my health now and just my long-term goals with it and, what I'm gonna do.
Tell me about some of your, long-term goals that you have so far.
Um, I, you know, when it comes to smoking, I'm really thinking about maybe being able to cut back a little. Um, Quitting is a bit ambitious right now. I don't think I'm ready for that, but if I could find something that took the stress away or helped to manage some of the feelings that I have without smoking, 5 to 6 times a day, I would be open to that. So that, my doctor says at least if I'm cutting back, my blood pressure will be a little bit better and my heart and general health will be better. So, my goal right now would be to maybe smoke 2 to 3 cigarettes a day instead of 5 to 6 and just take things slowly one day at a time and see how I do. But quitting is just, I don't know, that just seems a little bit out of out of the picture of reality right now for me, honestly.
Okay. And tell me a little bit more about, what your doctor's saying right now with, the smoking and everything.
Yeah, so she said because I've been smoking for 7 years now, I'm past the 5 year mark. So some of those other health implications are starting to set in. So I could have trouble breathing. My blood pressure is starting to be impacted. I'm at a higher risk of stroke and heart attack. I don't know if she was just trying to scare me into it. I think it's real, but she did her job. It worked. I see my parents and grandparents and aunts and uncles, everybody's smoking, and they're much older than me and they're doing fine. But my doctor explained that, it might not be right now that it affects them, but physically it is affecting them. So, um, that kind of scared me into things, and I just um, didn't really like those blood pressure numbers that I was seeing in the office. And she was explaining that the shortness of breath that I'm having when I'm exercising could be because of the smoking too. And I don't know, I never thought that could be from smoking, but now that she said that, it made me more aware, like, wow, I am starting to feel the health impacts on a daily basis.
It sounds like, smoking has really been affecting your life, and that you've noticed that, and that shows that, you're really paying attention to your overall health.
I'm trying to take it more seriously, because I don't want to be 60 years old and smoking like all my family members do. But if I continue with 5 to 6 cigarettes a day, who knows? Soon it could be a whole pack a day, and then I'll be just like my grandparents with that terrible smoker's cough all the time and always sick and always coughing and just smelling like cigarettes. It's just, I don't know. I'm starting to think it's just a gross habit, and I'm considering cutting back and um, finding a better way to cope with how I'm doing.
Okay. You, I know in our previous session, you mentioned your family and how, there's a lot of smokers in your family. What do they think about, you wanting to maybe cut back on your smoking?
It's funny. I was talking about it last week with my family on Sunday. We were having dinner, and they kind of made fun of it or made a joke out of it. They said, "Oh, you can't quit. It's just part of who we are. Everyone, we like to smoke and we like to eat. It's part of our culture." And they were kind of saying, "Oh, it would be really hard. You've been smoking a long time now. It's just, they kept saying it's just who we are. It's just who we are." And I don't know. I left that dinner driving home and that night just feeling like, is it really who we are? Does it have to be who we are? And why? Why do we have to smoke? Why do I have to smoke in order to fit in with the family or to be social at different gatherings? And um I don't know, it got me thinking, and them doubting my ability to quit or set these goals or want better for myself. It almost made me want to do it even more and show them, I'm taking care of myself. I'm putting myself first, and I can do this regardless of what you say. So that was a pretty eye-opening experience with my family, and um, I don't want to be 70 years old like that smoking. So
It's really, great that, even when your family might be, against the idea that, you're still staying true to who you are.
Mhm.
And, you've set that kind of want for yourself and you're going towards achieving it. That's really great.
Yeah, I'm definitely open to the next session and what that would look like in terms of getting this done, cutting back and doing better.
So just before we, go to wrap up, I do just have another question for you. And it's currently, as of right now, what does your smoking look like? Like, how many cigarettes are you doing a day? What's your doctor kind of saying about that? Just those sort of.
Mhm. Yeah, I'm still smoking 5 to 7 cigarettes a day, and she said my blood pressure is still not great, and she encouraged me to do the second session because things are only going to get worse.
That must have been, a little bit difficult to hear. So I I assume.
It was very difficult.
Okay, so just bringing the session to an end, just because I am being mindful of our time. In this session, you really discussed and were really open about, your cigarettes, and how you do about 5 to 6 a day, how you're looking on maybe, cutting back. But your family is, you know, they also smoke a lot, and so you're a little bit worried about, what they will think and what they will say, especially during a time when, it can be a little bit stressful. Quitting smoking is a big step for you.
Mhm.
Um, and so you're maybe thinking about wanting to, come back and maybe discuss, some goals that we can have, or anything along those lines, and just, see what maybe cutting back on your cigarette intake may do for you. Would that sound fair to say?
Absolutely, you got it.
Awesome. Well, Nicole, just because, we are out of time, I do want to really thank you for coming in today. Sometimes these conversations aren't the easiest, but thank you so much for, coming back and having another follow-up appointment. And if you want to, come back for a third appointment, that's definitely something that we can discuss going forward.
Perfect. Thank you very much, Michelle.
Thank you. Have a good
All
rest of your
right.
day.
You too.